Pleural effusion. A pleural effusion is the abnormal accumulation of fluid in the pleural cavity, the space between the visceral and parietal pleura surrounding the lungs. A small amount of pleural fluid is normally present to lubricate pleural surfaces and facilitate smooth lung movement. However, an imbalance between hydrostatic and oncotic pressures or local inflammation can result in pathological fluid accumulation. This may impair lung expansion and cause compressive symptoms. Causes. Pleural effusions are broadly categorized into transudative effusions. These result from systemic factors affecting fluid balance without inflammation. They are usually bilateral. Common causes include congestive cardiac failure, the most common cause, hypoalbuminemia, for example in cirrhosis or protein-losing conditions, nephrotic syndrome, which leads to protein loss and low oncotic pressure, and hypothyroidism, which is less common. Exudative effusions. These occur due to local inflammation or injury to the pleura, leading to increased capillary permeability and protein-rich fluid accumulation. These are usually unilateral. Common causes: infection, for example pneumonia, parapneumonic effusion, and tuberculosis. Malignancy, for example lung or breast cancer, or metastatic spread to the pleura. Pulmonary embolism. This may lead to pleural inflammation. Autoimmune disease, for example rheumatoid arthritis and systemic lupus erythematosus. And lastly, trauma, which causes bleeding or inflammation in the pleural space. Symptoms. Respiratory symptoms include shortness of breath, pleuritic chest pain, which is sharp and worse on inspiration, and a dry, non-productive cough. Systemic features include fever, especially if infective, and fatigue or malaise. Signs. Inspection and palpation. Reduced chest expansion on the affected side, decreased tactile fremitus, and tracheal deviation away from the effusion in large effusions only. Percussion. Stony dullness over the fluid-filled area. Auscultation. Diminished or absent breath sounds, and a pleural rub may be heard in early inflammatory stages. Investigations. Blood tests. Full blood count to assess for infection or inflammation. Serum albumin and lactate dehydrogenase (LDH) is helpful for classification. Imaging. Chest X-ray. Blunting of the costophrenic angles, meniscus sign, which is concave upper border of fluid, complete opacification in massive effusions, and tracheal and mediastinal shift in large effusions. CT scan of the chest. This is more sensitive than chest X-ray. It helps differentiate between transudative and exudative causes. It assesses underlying pathology, for example masses and infection. Diagnostic thoracocentesis. Fluid aspiration and analysis are crucial to determine the cause. Light's criteria is used to distinguish between transudative and exudative effusions. Light's criteria. An effusion is likely exudative if at least one of the following is true: pleural fluid protein to serum protein ratio above 0.5, pleural fluid LDH to serum LDH ratio above 0.6, and pleural fluid LDH at least 2/3 the upper limit of normal for serum LDH. As a quick guide, Exudates have a protein over 30 grams per litre, whereas transudates have protein less than 30 grams per litre. If it's between 25 to 35 grams per litre, then Light's criteria should be applied to ascertain whether it's transudative or exudative. Management. Treat the underlying cause. Manage the primary condition, for example, diuretics for heart failure, antibiotics for infection, and chemotherapy for malignancy. Therapeutic thoracocentesis. This is performed to relieve dyspnea or when infection is suspected. Chest drain insertion. This is indicated for large symptomatic or complicated effusions. Video-assisted thoracoscopic surgery, VATS. This is used in recurrent, loculated or unclear cases. It allows direct visualization, biopsy, and drainage. Pleurodesis. This involves obliterating the pleural space chemically, for example with talc, or surgically. It is used in recurrent malignant effusions. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today